If you've been tested for COVID-19, you must quarantine at home until you receive your results. If your home is overcrowded or not conducive, then inform the testing authorities so that they can make arrangements for you to quarantine at a government facility instead. In the spotlight this week is Alvin Hart, Quarantine Facilities Manager for COVID-19. He discusses how quarantining can help to break the chain of infection.
For persons who get tested for COVID-19, the recommendations is that these persons should go home and quarantine at home until their results are back. We have used a number of measures during this outbreak to try to bring this disease out under control. We've used isolation, we've used quarantining, social distancing, proper hand hygiene, use of personal protective equipment like wearing of masks, and all these components, we need to work all them together. If one cog in this wheel or one link in this chain is weak, we will continue to have problems. And one of the challenges we're having is just what we mentioned just now. When persons get tested, they don't go home and quarantine until they get bad results. What is happening now? Persons will get tested today. You were told, John, you were at work yesterday, and we just got a call that Bob, who works on the floor with you, tested positive for COVID-19. You'll be required tomorrow to go to St. Philip Polyclinic and have a COVID-19 test. She's on. Me and Bob work on that vehicle together all yesterday. I give him the wheels. I give him back the tool, and we did this together, and he positive. I wonder what happened to me. You established that you are a primary contact of Bob, but just saying that, you talk about how close you were. When you realize that, you go for your test the following day. After having that test, your role and responsibility as a citizen of Barbados, as a family man, as a concerned person for everybody around you, is to go directly home and to quarantine in a room by yourself. If it is difficult for you to quarantine in a room by yourself, you have to start to think about those around you, because you are primary contact. You should go home and you should wear masks, whatever you do. You should try to limit your contact with persons around you. And if by any chance you realize, I can't quarantine at home, but there's 10 more people in the house with my grandmother and my grandfather and my mother, all those retired over 60 with diabetes and hypertension, I can't quarantine at home. You should have said that when you go to the polyclinic and said, Doc, I know I was a primary contact, but my household doesn't lend for me to quarantine at home, and I don't want to put the rest at home at risk. What can I do? There are things that can be done. And we've had a few of these cases, but we need to see persons taking responsibility of their health and persons around them. We have the government quarantine facilities. Not a lot of traffic is coming in now. The air traffic have decreased. So the numbers of persons in government quarantine facilities are down. And we can make arrangements to house you in these facilities until your results are back. If you come and your results are negative, you go back into your population at home. If your results are positive, you are transferred directly from the quarantine facility to the isolation facility. What we are seeing in this current outbreak and at this phase is that we are not breaking the chain of infection after persons are tested. What is happening is that after persons are tested, they're going home, but they're going to stop by the shop. They're going to go in the supermarket. Some people get tested and don't see anything, know they've been exposed, and they go back to work. And they go on the block. And some of these areas, these villages and so on, are so densely populated that when you go on a block and you have 12 men on a block, or you go in a shop, or you go and visit your aunt, your mother. I heard cases of persons saying, well, when they finish this testing, I'll look for my aunt. I'm going to look for my sister. I'm going to look for my mother. You are now exposing all of those persons to COVID-19. And when we look at the data, we are picking up entire families because of this. Everyone needs to take responsibility for their health and others. You get your tests. You go directly home until your results are back. We know we had a challenge with getting out results in time, but we have worked past that, and we're now on top of the game, and we're getting results in 24 to 48 hours. You can wait. You can wait. You go home, you stay in your room. You don't mix with the others. You keep on your mask. You perform your hand hygiene. You clean your surfaces. You mix a chlorine solution, or you have your Lysol. You do all of those things until you get back your results. And once your results are back and they're negative, or if your results are back and they're positive, you can be removed from that setting without infecting the others. If there's a possibility that other persons in the house can leave and go somewhere else while you're waiting your results, that is another option. But we at the Ministry of Health are encouraging persons to state to the provider or to the polyclinic, wherever you go, that if your living conditions are not good, especially if you know you are primary contact and you had very close contact to that person who have tested positive, you should let them know that my conditions at home are not conducive for me going back. If I go home, I put my entire family at risk. We want to break this chain. We are seeing too much every day. Every day we are picking up entire families, 5 people, 6 people in a household, 7 people in the district, and we want to break this. But everybody must come on board.
What about if a person was a secondary or tertiary contact, or in a case where somebody decides to voluntarily go for a test? What happens in those cases? Right.
So I spoke a lot about primary contacts, but secondary and tertiary contacts, you must also be very cautious. But in every category you go in, your risk is less. So if you are secondary contact, your risk of becoming infected is lower than that of being a primary contact. And if you become a tertiary contact, your risk of being infected is even lower than that. However, there's still a risk that you can become positive. And you must still take all the necessary precautions. Once you had a test, regardless of which category you fall in, because you had that test for a reason, because you were either exposed to the positive case, or you had contact with the primary contact, or you had contact with the secondary contact, so you were somewhere along the chain of a contact. So the possibility exists. Your risk is lower when you come down, but there's still a risk of you becoming infected. So you need to take the same precautions. If each contact, regardless of which category you fall in, take these precautions, we will see a drastic reduction in the transmission of disease within households. And this is important. And this is a challenge we're having now. We spend a lot of time talking about persons coming into Barbados, and we need to quarantine them. This is time we need to quarantine ourselves within Barbados. Over 90% of the cases recorded each day are Barbadians, or persons, as the minister would say, with a Barbados passport or Barbados ID. So now the onus is on us to protect each other that live with us or around us.
What would you say to employers who are asking staff to return to work before they receive their results?
As far as the business community is concerned, and we have seen that there have been there's very few businesses in Barbados that have not been affected by COVID-19. And persons and business where persons have tested positive, the same thing apply. When persons go for tests, they have to remain at home until their results are back. What businesses have to remember is that if someone was tested for COVID-19 and they go to work and their results come back positive, think about all the other persons within that business that would be exposed. Right? So the important thing is that you're tested positive, you're tested, go home and await your results. Regardless if you're working, you're going to school, regardless of what you're doing, go home, quarantine yourself. This is where local quarantining now is important. The emphasis now is off. We still have few people coming in and they're quarantined for 5 days. But for our locals now, quarantining now this is local quarantine time. You have your test, go home. Stay home until you get your results.
So you want persons to quarantine after they have been tested for COVID-19. But sometimes there's confusion between the terms quarantine and isolation. Can you explain the difference?
Yes, it's terms that are always misused, even by persons who I would say should know better. And throughout the entire pandemic and outbreak here in Barbados, we've been hearing these terms misused. But we will spend a lot of time as the Ministry of Health and Wellness trying to define the two of these, even from the beginning of the outbreak. But it's always good to keep reminding persons of the definition between the two. And they're two separate and distinct things. Isolation, you isolate persons who are ill, who are showing signs and symptoms of the disease, and you isolate them and you treat them with the hope of them getting better, and then you discharge them. But you quarantine persons that might have been exposed. In quarantining, you await results, regardless of, and we will get into that, if you are quarantining in a government facility, you're quarantining in a hotel, or you're quarantining at home. Because the emphasis being placed on this is that even if you go to have a routine test, you had a test for a reason, and you have to go back home, you should quarantine at home until you get back those results. Your quarantine is a precaution that in case, because of your exposure, you might develop COVID-19. In some cases for quarantine, and it's an important cog in the wheel, because what happens is that over a period of time, after monitoring you for 2 or 3 days, you then say, I feel like you're having a sore throat. And we pick that up, and then we get back your test and we realize you're positive. Then you're transferred from quarantine to isolation, where you're then treated. They're monitoring you hoping that you don't have severe disease, and at the end of that process, then you're then discharged. Isolation is when you are showing signs and symptoms of disease, and when you have tested positive for COVID-19. And when you've tested positive for COVID-19, you are then transferred to an isolation facility.
So now that we understand the difference between isolation and quarantine, for persons who quarantine at home, what are some of the measures or the precautionary steps that they can put in place to ensure that they don't infect others in the household if they are indeed positive?
You let everybody know, I went and had my test today. I'm going to be quarantining in my room. Bring my things and put them at the door. Just knock the door and leave them there. I will come out and pick them up. You understand? If you're going to, and most of the things that you use at that time might be disposable. If they're not disposable, you just give some advice to the person. All right, when you moving my things from out there, when I'm finished, make sure you put on some gloves and wash them. Mix a little chlorine solution when you're washing the wares. You wash it with your soap and water and the chlorine solution, and you kill those germs that are there. You practice from within. But these basic things some persons take for granted, and some persons say, well, this is the first time I know that I should stay home. This is the first time I know that after I had my test, because of my exposure, and I go in my house, I should keep wearing my mask until I get back my results. You know, and these are the balls we are dropping. Our family contact, our close contacts, the things we do in our circles, those are the things we are dropping. So the infection control practices in the household need to step up. Wearing your mask, sanitizing, disinfecting, even a little social distancing. When you come home, take off those clothes, go and shower. Then we could talk. You know, those kind of, so those small things are things that we need to work with as households in Barbados, even in our family settings, because too many families are going down to Harrison Point together. And over the next couple of weeks, we would like to see that broken. So if we take those things in consideration that we spoke about earlier, when you go and get your test, you go directly home. You know, you don't stop by anyone and say, well, I know how to test. The thing burned my nose, and this thing. You stop there for an hour, and then you go up by John, and you stop by John, and then you pass and you see your friend by the shop, and you stop. No, get your tests, you go home, and you wait on your results.
If you need more information on quarantining, please contact the COVID-19 hotline at 536-4500 or email covid19hotline@barbados.gov.bb.